97 people. We have 97 people registered for the this first webinar of 2021. So we're just going to wait for a minute while people get in. There's about 32 people in so far. So we'll just give it one more minute. So welcome everyone, I'm Paul Glasiu. This is our first BESSI webinar for 2021. We had a very successful series of webinars last year on particular content topics related to COVID-19 and its relationship to the BESSI interventions. For this first one this year, we would like to get more input from you. So what we're going to do is give a brief update on where things are up to with BESSI and the general directions, but spend most of the time on this webinar in a discussion, either through the chat or getting people to talk, and we'll be taking extensive notes during this. So I'm just going to give a very brief description of BESSI and where we're up to and what we are doing. So first of all, what's BESSI about? Most of you who have attended previous webinars or who are on the GIST mail list will know that basically BESSI is dedicated to increasing and ensuring that the research needed for the pandemic is done. So this is the set of 7 principles that we've been developing through the GIST mail list, and it's really the first one that's central to the BESSI mission: ensure that research to develop, evaluate and implement BESSIs are a key part of the global preparedness and response to COVID-19 and to other infectious diseases outbreaks, because we see the principles about BESSI being relevant to future epidemics, pandemics and other outbreaks. And another number of other principles about using interdisciplinary approaches, being able to compare different BESSIs, using a variety of research methods, making sure that research is across multiple countries, that we develop the BESSIs in a careful, theoretically developed way, and that we look at the most vulnerable and high-risk populations. Next. The sort of background to this, why we got interested in this, was early on in the pandemic, it became very clear that there were lots of drug and vaccine trials going on, but very little research to improve the things that have been most useful in the first year of the pandemic, which was the behavioural, environmental, social and systems interventions. So we developed a scorecard that's on the BESSI website. This is the most recent update from the 10th of February, which shows, using the Epistemonicus database, that there had been at that stage 2,155 trials that were registered, 342 of those reported. By comparison, for the BESSI trials, there were only 13 registered and 4 reported. So we have this enormous difference between the number of trials. And of course, trials aren't the only sort of research, but this was just a way of getting registered trials as a comparison between the drug trials and the amount of BESSI work being done. Next. So there are actually more trials than appear on Epistemonicus, and so we've found various means of trying to identify all of the trials. If you go to the protocols link on the BESSI website, there's a link to a database that we're keeping that now has 24 trials on it. And this is the distribution of where they are. The ones in blue here are the European countries, which are the predominant source of this small number of trials. And then Canada, USA, Brazil, the Americas, then 5 from Asia Pacific region, and just 1 from Africa that we've identified from Guinea-Bissau. And there's 1 multi-country study going on. So a diverse number of countries involved, but a very small number of trials in total compared with drugs. So who is BESSI? It started by the executive that you can see here, Susan Mickey at UCL, Jeremy Grimshaw in Ottawa, myself, Marika Shumaris at the BESSI Centre. But more importantly has been the involvement, and we'll talk more about that as we go on in the seminar, is the 155 members on the BESSI email list. There are 465 followers. And we're also trying to liaise with a number of groups. Jeremy is actually part of the COVID End group, for example. Susan is on the World Health Organization tag on behavioral insights, and Marika's joined up with Glopidar. So there are a number of international organizations that we're trying to join up with, most of whom are promoting the BESSI ideas, but not promoting BESSI research at the moment, which we see as absolutely crucial. Next. So the webinar outline today will be some brief presentations. Marika first will talk about the need for disciplinary and global perspectives. Susan's going to talk about where we are. Jeremy will talk about building collaboration, but we hope to leave about 30 minutes for discussion about how to build the BESSI community, how we can access funding, not just for us, but for everybody within the BESSI community. So that's for you guys as well. How we can incubate better ideas and how we can future-proof this. And Susan will give a bit of a summing up at the end. And with that, I'll hand over to Marika.
And thank you, Paul. So I'm Marika Shumaris from the BESSI Centre, and I want to talk a little bit about this funny acronym and why we think it is so important. What really is the collaborative BESSI perspective? And I think the easiest way to illustrate this is by talking through how all of these perspectives interlink and how important it is that they interlink. We have absolutely seen in real time during the COVID-19 pandemic, and we continue to see this every day. So let's pick our acronym apart and put it together again. So behavior for pandemic preparedness happens in a physical environment, obviously. And this physical environment is shaped by people's interactions, by their social interactions, by their socioeconomic purposes, by their political environments. And then these interactions are reflected in and structured by systems that sometimes take years to build, sometimes emerge rather swiftly. And then, of course, the cycle closes again, because these systems then in turn influence how behavior happens in an environment and so on. You see the point. So you see immediately that actually to effectively work on transmission, counter transmission, to be effectively prepared against a pandemic, these need to interlink. And what would that look like? I'll give you my sentence again. So you see that behavior, pandemic preparedness, physical environment, social interactions. What would it look like when we translate that to all the disciplinary perspectives that we need? It would look something like this. You need behavioral science, you need infectious disease specialists, you need people who know about non-drug interventions, you need engineers, you need geographers, people who know about politics, anthropologists, and so on and so on. So it's a very, very ambitious agenda to bring these perspectives together, but it's also one that we absolutely think is necessary. And it's also necessary in other ways, because at the moment, not only don't we have a joint perspective from these various disciplines, we also have actually very limited knowledge about the people that are affected in a pandemic. Here's a map of the world scaled to population. Another way of looking at this map is to say, these are the people who are affected in a pandemic. But do we know who these people are and what preparations they need? We know very little. This is the same map, but it's scaled now to published research. So you can see how all of a sudden things look very, very different. Our knowledge is humbling. And that is why we're very keen to not only bring together these perspectives, but do so on a global scale. And with that, I hand to Susan.
Thank you, Marika. So over the last few months, we've been doing a few things to build up this collaboration, find colleagues all over the world who similarly think this is really important and are interested in getting involved in some way, and also ensuring that we have a good range of disciplines and also cover across the world. So we've had 6 different webinars to date that really feeding into the current one, looking at science, policy, research funding, engineering approaches, and then the last two have been different international perspectives in terms of what we can learn from it. We've had 18 speakers from the following, as you can see below: Africa, Europe, Latin America, Australia, and North America. As mentioned before, we have a very active email list. So we've had 141 posts on 34 different topics. And we also, and thank you very much to any of you who are on the call now who responded to the survey, put out a survey to find out what topics people would be really interested in developing. So we had 50 respondents from 28 countries in total. And as you can see here, I won't read them all out, most from Europe, and we need to do better in terms of a global spread, but we hope that you will join with us in doing that. But even so, given that we've just begun this work, I think it's a really gratifying spread of countries. And here we also have people's backgrounds in terms of academic disciplines and professions. Now, not everybody identified with a discipline or profession. They might have been a knowledge user and so hasn't responded to this. But here you'll see there's quite a range over psychology, a lot of psychology. Obviously, that's the kind of behavioral and social sciences, but public health, epidemiology, health services research, general practice, implementation science, organizational science, and you can look down the right-hand column there. A really nice spread. So in terms of people's expressing what they particularly would be most interested in if they had to choose between behavioral, environmental, social, and systems, 62% behavioral, 47% systems, 21% social, 15% environmental. Again, a good spread. And I'm delighted to say also we have expanded our team of 4 to include an environmental scientist and an infectious disease expert. Now, sorry about the small typing here, but this is asking you which areas you think any demonstration projects should be in, because one of the things we're obviously going to do as the next step is to seek funding to really get this going on a much bigger scale. So you can see from this that the pale green one, adherence to protective behaviours, there was big interest in that, followed by trust and communication, which obviously is very associated with adherence, then vaccination uptake, followed by test, trace and isolate, both of which are absolutely key to pandemic control. And then there was a range of others. I don't know if we've got the others. Oh yes, here we go. So ventilation and healthy buildings, mental health, targeting hard to reach groups and lower and middle income countries, and trade-offs. So a really rich range, but also you know, some clear pointers in terms of adherence and vaccination uptake as a sort of outcomes that we'd be looking for with test, trace and isolate also. So we're going to be very interested in your contributions in this discussion to see if this aligns with your interests or you think there are other topics we should be focusing on. Okay, and now I'm going to hand over to Jeremy, who will talk about building the collaboration.
Hi everyone, good morning from Canada. So delighted you joined the webinar today. What we've done so far in this webinar is sort of describe what we've been doing over the last sort of 6 months or so. And that's very much been about raising the profile of BESSI as an area that urgently needs a sustained interdisciplinary research effort if we're going to improve societal resilience to infectious diseases. However, it's the next stage which is probably most important, and BESSI's success will be determined by the extent to which diverse people, so people on this call and others around the world, engage with it and contribute to it. So we now are looking for input from all of you. about how can we build the BESSI collaboration? What will make this something which globally can make a difference to the lives of citizens around the world and society's preparedness for infectious diseases? So I've got a number of questions that I'm posing to you in the next couple of slides, largely to, sorry, can we go back, Marika? Largely to sort of stimulate the discussion. So one of the questions we've got is how can we identify and engage interesting researchers or interesting researchers and knowledge users globally? So we have 46 attendees at this webinar. We've been in touch with about 150 people around the world. If we're going to do good justice to this area, we need to build a community of thousands. How do we build capacity for BESSI research globally? We're aware that there are that the ability to conduct high quality BESSI research is not evenly spread across the world, and so there's also a big issue about how we can build capacity, and also in particular how we can build interdisciplinary capacity. So we have groups that have not traditionally worked together, working together to address these questions. Next slide, Marika. What should be our initial focus? So Susan has presented the responses from the survey, but you may have other ideas, or you may sort of also think about not just the research areas, but other activities that would be particularly useful, or position papers or methodological developments we should focus on. I mean, how do we identify relevant funding sources to support BESSI research and collaboration? So the resin study from Southampton in the UK has identified that less than 4% of the COVID research funding globally has gone to BESSI research. So we need to build conversations with funders, but also need help from people around the world thinking about, actually our local funder may be able to do this. I'm going to submit something there. How do we encourage the international and interdisciplinary researching communities that may not have previously worked together? One of the key issues that we're aware of is that BESSIs are likely social, culturally, contextually and politically sensitive, and therefore as we're doing research we need to make sure we're not doing it in maybe a single country, but actually we're replicating that so we can understand the extent to which those factors are effect modifiers, and in particular also how could you support the BESSI collaboration. So the four of us have been sort of leading this, but really we're very keen to see other people coming in and helping us, and basically taking whatever leadership roles or roles in BESSI you think would be helpful. And this is from the survey again. You can't necessarily see what the responses are, but so 80% of you said you want to participate in email discussions and webinars, which is great. More importantly and more impressively, 90% of you want to collaborate on BESSI related research. Only 30% of you want to lead BESSI related research. So I think that highlights this sort of idea about how do we structure research teams that could move this forward. 80% would be interested in BESSI working groups on specific topics. Only 20% of you really want to get involved in the kind of messy, boring stuff of governance structures, which is fine, but we do need more people than the four of us doing that. And 50% of you want to help with training and building capacity in BESSI research, which I think is really, really important. So that just gives you an idea about what people said in the survey, but what we'd really like you to consider today is sort of, what do we need to do? What can you do? And both today and then at the end we'll give you an email. Please email us to sort of basically say or let us know how you'd like to contribute to BESSI as we move forward. And with that, I think I hand back to Marika.
Indeed. Thank you very much, everyone. And this is already the moment when we go over to all of you. It would be really wonderful to hear reactions, feedback, also, some insights of maybe what you have learned from the BESSI collaboration so far, how you have seen discussions expand in whichever area you work in, and where you would put priorities. So there's two ways of doing this. As always, you can raise your hand by clicking on the button on the top bottom right, or you can put a question in the chat, which we're monitoring as well. And so then we can unmute you and you can ask your questions. So let's see if we have anyone already who wants to ask a question. Let me have a look.
So Marika, there's a question from Kazi Rahman. I'm not sure I got said the first name correctly. So I think it'd be really helpful if Lucas could unmute Kazi and they could make their comment.
Great, Kazi, we will work on the technology to get you unmuted, and then maybe you could ask your question.
There we go.
Thank you. Can you hear me?
Yes, very well.
Okay. Good evening from Northern New South Wales. So I asked this question because I have a kind of dual role. I work with the program. I'm also affiliated with academia, and I have seen a completely opposite environment. And when I work in the program, I see that how little the program people are interested in research, because they are so much focused on the implementation aspects, which is very important. So my question was, if we want to bring changes, we need to involve the program people, and it's not that easy. So how are we planning to do that?
Maybe Kazi, I can ask the question right back to you to kind of elaborate, or maybe even just do a bit of brainstorm with us. How do you think they could be involved? Where are the barriers? Why is it not happening? And what opportunities do you see? And then John Overt Fight, I saw that you're raising your hand, so you'll be next.
I'm actually new in the program. I was mostly in academia all through my career. So I'm also learning, and I'm also struggling a bit. So I think this is an important aspect of planning for future work. For example, if we think about COVID, we are so busy with identifying cases and doing contact tracing and focusing on all the day-to-day activities, and we don't want to miss any of those work. And then if someone comes to us and say that we want to do research, we might show less interest, because that might distract us from what we are currently doing and what we are supposed to do. So how we are planning to make that collaboration. Thank you.
Jeremy, do you want to come in on this, and then we'll go to John?
It's a great comment, Kazi, so thank you for that. From my perspective, I think it's impossible to make progress in this area unless we are actually engaged with people on the ground who are making those decisions about program design and program evaluation. But I think the realities that you're saying they represent the experiences of people in programs, that they're incredibly busy, that the pace, particularly during the pandemic, is a major challenge for that. So my sense is that we need to make sure that as we go forward with research, we're building relationships with them. That will often happen locally in your own country, in your own setting, because those are where we can build the relationships. We need to make sure that we frame the research as being helpful to them and unobtrusive as much as possible. And we need to sort of try and make sure we're answering the questions that they want. I think one of the things we've been considering is, we need to think beyond the pandemic. The pandemic is going to be with us for the next, 12, 18, 24 months. But we need to also think about sort of, how do we plan research beyond the pandemic, which will also build BESSI knowledge, which I think also could be done in a way which is less pressured than under the particular constraints of the pandemic.
Great, thank you. So we'll go to John next. So if John could be unmuted, and then just to warn people, after John, we have Aditya, and then followed by Stephanie. John, over to you.
Thank you very much, and thank you everyone. Super initiative, and thank you for all the work and effort that you've put into this. It's a good job that you really haven't had much else to do at the same time. So thank you very much. Let me tell you where I'm coming from, and then raise the questions or the issues that I think others would raise as well. Where I'm coming from is that I work 50% for Region Stockholm Healthcare as research and development. So this is a very practical applied, but what we're trying to do is use best evidence to make sure we're effective. And secondly, I work 50% for Karolinska Institute in the management and implementation program there. And where I'm coming from sort of interdisciplinary wise is implementation improvement science and organizational behavior research and very systems thinking kind of background and approach. So where I'm going from this is my experience has been the last year in doing, let's call it action research for Stockholm Healthcare, to learn quickly from the hundreds of changes that we've been making, most of which are not evidence-based, many of which at service delivery level, many of which are also IT and systems changes. So there's a combination of those. And I've tried to draw on whatever disciplines or knowledge to provide best evidence frameworks for collecting data, but also to provide best evidence rapid summaries. So the two things that I'm raising there is the range of disciplinary perspectives that I've had to draw on to find whatever's relevant and helpful conceptually, but also empirical evidence. And the second thing there is to raise issues about the research and systematic methods that we use to do what I call rapid impact research. So I'm not in the RCT field, and I'm drawing a number of different disciplines. Now, where I'm going here, and the question that I want to raise really is, I think we need to position BESSI in relation to the many other initiatives and movements and programs that are going on at the moment. And either, I mean, one option is to say we're a kind of an umbrella approach, or that we're in some way distinctive or differentiating ourselves. So the other areas or movements that are sort of bounding on this field are quality improvement, implementation science, organizational behavior research, and the other movements and programs like the Global Implementation Society, IHI, ISQA, and others. And I think one of the challenges, but also it may be a benefit, is being global, and there are many other colleagues in lower resource settings who would very much benefit from and want our support and help. And this is going to be very, very important in the next couple of years, and indeed for the next pandemic. But at the same time, how do we run good, rigorous projects, controlled trials, or other rigorous and systematic approaches? So I think my main question or area that I'm zeroing in on here is, how do we position and differentiate ourselves? And, you know, are we trying to do too many things? And I'll stop there.
Great, John. I think Susan is dying to say something. So
Yes.
after Susan, we go to Aditya. Susan, please go.
Great comments, John. And these are exactly the things we've been struggling with and discussing over the last more than 6 months. And certainly, I don't see this. Why we called it a collaboration was not that we want to be distinctive from anyone else at all. What we hope to do is make a contribution to pulling together and supporting all the global BESSI work that's going on. And as Paul or Jeremy said earlier, you know, 4% of research funding so far has gone into all of BES and SIs in terms of COVID research funding. And so what we want to do is do all the things you talked about, you know, provide an umbrella, provide a catalyst, provide ways of capacity development, making links, research collaborations, improving the translational pathway so that we're working with people on the ground in policy and practice, rather than having, you know, researchers producing knowledge. And definitely, you know, we have systems in there in BESSI. That, I mean, I'm sure the others have got things to say to add to this, but I would see us as trying to pull all the disparate when I say disparate, I don't mean disparate in themselves, but the many diverse activities that are going on the basis that united we're stronger and in a better position to get funding, to get things going, to support and help each other all over the world.
Thanks, Susan. Before we go to Aditya, I just wanted to, sorry, Paul, I just wanted to make one response to questions that have come up in the chat, which is people are asking how to connect or even how to sign up. And based on what Susan just said, it's not so much a matter of signing up, but it certainly is a matter of connecting. And at the end of the session today, we will reiterate how you can connect and what's the best way to stay in touch. And hopefully, obviously, also today we find other modalities of where to focus. Paul, do you want to come in, or shall we go to Aditya first, because he's been waiting for quite some time, and then maybe we'll go to you. And I also wanted to ask people whether you could please introduce yourself, because we see your names, but not necessarily where you're from, with a notable exception for me for the next speaker, who's my colleague Aditya from the BESSI Center. So Aditya, over to you.
Hi everyone. Lovely to see some familiar faces. Hi Susan, hi Marika. I mean, I could have asked this question by just taking Marika to one side and ask her this question personally, but I think I'll ask it right away. So typically, I think based out of India, and that's where I'm currently based out of New Delhi, and the general sense, and then something that we work on every day is this sense is that a lot of research typically comes from the global north, and it's either contextualized to the needs of the global south, and there's very limited ideation or idea generation that's really happening in in the developing world. I'm curious to understand that because we, as I know, like from the BESSI Center's work, that what we are really trying to do is to make sure that all the ideation is ground up, and we so that we can take a very nuanced understanding of the different context of people, and so that the the solutions are coming from the people themselves. How my question to you is that how would BESSI try to bridge this gap, or like how is BESSI positioned to sort of answer to this problem that we deal with on a daily basis? Thank you.
Thanks, Aditya. I have a sense Paul wants to come in, but in a way I want to do the same thing and put the question back to you. How do you think is a good way of doing this? Because it is absolutely an ethos that underpins. So what are your thoughts on how BESSI as a broader collaboration could really commit to that and put that into practice?
Mm-hmm. Yeah, I mean, the way I think about BESSI is something which kind of makes a lot of sense. And when I say country level, I think there are a couple of collaborations. For instance, the recent social norms collaboration is very typically focused on South Asia, and I've seen a lot of new idea generation happening in these sort of platforms. So I feel like having separate geographical hubs of researchers, wherein BESSI is that's a part of like ensuring that the collaboration is meaningful, but the meat of the ideas is coming from these countries. I think that's how I would see it. But
thanks, Aditya. Paul, maybe you want to respond, and then afterwards we'll go to Stephanie. Paul.
I just wanted to mention of the 24 trials I mentioned, there are 4 trials studying the impact of masks. The one that's already been published from Denmark, but the other 3 are in Guinea-Bissau, Bangladesh, and India. But the Guinea-Bissau one is working with a group from Denmark called Engineers Without Borders. And I think the other 2, the Bangladeshi and India, working with American partners. So they've all been partnerships, but interesting to see that in the global south, that's where 3 of the 4 trials are going on.
Thanks, Paul.
We need a lot more than that, 40, not 4.
We'll go to Stephanie, and maybe after that we go to James Thomas. So James, if you can get ready, but to Stephanie first. Stephanie.
Hi, everyone. My name is Stephanie Buell. I'm a policy and practice advisor from ODI, the Overseas Development Institute. I have a specific question, but actually I had as well a bit of a response as to the first question by Kazi around how do you link research to practice. And I think everything that's been said makes sense. Obviously, the details are in how to do it. But I would argue that it's not just about making sure that research is helpful. It's really about making it crucial to program effectiveness. So having dedicated resources within a research program that obviously translates research findings, but also that creates a space in the design of the research that speaks specifically to existing implementation challenges. Because personally, as a sort of practitioner, I've always found that what's difficult is when you're given recommendations or solutions to problems that you didn't even know that you had, and it just becomes sort of overwhelming in that sense. So I would really argue for dedicated research, dedicated resources on the research side to sort of ensure that collaboration throughout, and not put the onus on practitioners who are often sort of time poor in that sense. So that's just my 2 cents. But my actual question was whether this collaboration would be looking beyond not just COVID-19, but beyond pandemics and epidemics in general, and look at the effect of these on health behavior. Because one thing I've noticed is the impact of people's perceptions of COVID-19 and perceptions of how different states have handled this has changed people's view and behaviors as to how they access healthcare, how they trust healthcare bodies, and so on. So I think that would be a huge added value that I've personally not seen addressed in any meaningful way up until hopefully now. Thanks.
Yeah, I think Jeremy also thinks that's a great point, because he definitely wants to come in.
I think it's a fabulous point, Stephanie. We've been talking a lot about the future proofing of BESSI because it was very much stimulated by the pandemic, but actually infectious diseases have a major sort of burden on mortality and morbidity globally. And it's also the endemic stuff, the stuff that happens day to day, the outbreaks of gastrointestinal diseases in nurseries, or the seasonal outbreaks, or the sort of outbreaks. So alongside the pandemic, we have an Ebola outbreak in, I think, West Africa at the moment. And so we very much see this as being something which is about personal and societal resilience to infections, period. And I think that will lead into these issues around behavioural change, and also hopefully sort of engagement with citizens, engagement with societies about how to do this. So as we're thinking about this moving forward, our horizon is not just COVID in the next 18 months or so. Our horizon is sort of all infectious diseases, and over a 5 or 10 year period or longer, to really sort of try and ensure that societies and citizens can address both our current infectious diseases and the concerns that we're going to have increasing new and emerging diseases.
I was going to always go one panelist and one audience member so that we get as much audience as possible. So I think I'll stick to that, and I'll go to James Thomas first, and then we go to Terry and Atle later. But James, over to you, and then Paul and Susan, I'll come to you.
Hello, I think I'm unmuted now. Hi. I put my question in the chat box because it was quite noisy here. I'm at home, but it seems to be quiet now, so I'm safe to talk. No, my question was just about using the James Lind Alliance. I don't know if you've talked to them at all, but they do some great work in terms of priority setting. You're all nodding, so you've talked to the James Lind Alliance, have you? So my question is redundant. Is that right?
Question's not redundant at all, James. We haven't actually talked to them. We're aware of them, and this would definitely be a piece of work. But in a sense, that's part of the next phase of work. Really, what we've been doing up till now is just making the ideas, spreading the ideas, finding the people. So anyway, that's a great idea for the next phase of work.
Thanks, James. Susan, do you want to use the slot that you have right now to say what else you wanted to say before?
Yeah, I was going to comment on the previous, was it Steph, the previous?
Stephanie, yeah.
Stephanie, about, especially about the behaviours. And I think at the moment, there's been a lot of focus on the behaviours that are required to get us out of this pandemic. So vaccination uptake in all communities. What we can see is there's very wide disparities, even within countries of different communities taking up the vaccination. Also in test, trace and isolate, which is an absolutely vital part of getting out of the pandemic. And all of these are behaviours. You know, first of all, do you know the symptoms and act on it in terms of getting tested? Do you give up information about those people who you have been in contact with? And do you isolate? And certainly in the UK, we've got huge problems and all of those, especially the third. But going forward, and I'm actually leading a paper on this for the UK government, we really need to be thinking about embedding behaviours throughout all of society. You know, what are the behaviours that we need to embed? Because is it acceptable to be having tens of thousands of people dying from flu every year, even in one country, when the kind of behaviours that have been being really pushed and really encouraged and taken up in many places can help with those infections as well as many others? So I really think we need to think about resetting society in so many ways. I mean, the inequalities, we could spend hours just talking about that, but embedding protective behaviours of you and of other people, I think is going to be a key part of going forward, and what I hope this collaboration will take on.
Thank you, Susan. I think we'll go to Terry Kemple next, but I just wanted to also say what's so interesting for me is that, of course, test, trace and isolate sounds very reassuring in some countries. In other countries, people might have very, very good reasons why they really do not want to be traced by anyone. So there's the issue of trust and public authority and politics is basically coming straight back at us, and which is very crucial. We'll go to Terry first, and then we go to Paul, and after that we go to Atle. Terry.
Hi, yeah, I'm Terry Kemple, a GP in the UK and past president of the Royal College of GPs. Always been interested and never really understood people's behaviour. And this really follows on a little bit from Susan's last point, that I think that the question I'm going to ask is, unlike research into pharma, which can give a urgent problem like COVID, a rapid and a clear outcome, behavioural research is much more important, but slower and usually with less clear outcomes. And so my question is really, is there one killer behaviour we need to understand and change to better avoid and manage the ever-present infectious diseases, just like flu that Susan was talking about, and future pandemics? Because clearly, if you want funding, you've really got to go for something that's going to really make a big difference in society throughout globally. So what is that one killer behaviour that we need to understand and change to better avoid infectious diseases in the future?
I know that was a question to Susan, but for fairness, we really need to go to Paul first, and then we go to Susan.
So it's a very interesting question, Terry. The one thing I'd point out that was alluded to earlier is that in the US, the number of kids dying of influenza in 2020 dropped from several thousand to 2. So the behaviours that have been implemented during the pandemic have actually been sufficient. The drop in COVID is obviously not as great because COVID has a different transmission rate, etc. But it's actually been sufficient for the flu. And I think that's very interesting, but it's no one thing. So I don't think there ever will be a single behaviour, but I think it's the Swiss cheese model of having a series of behaviours, and we need to learn to implement each of those layers better.
Great. Susan, do you want to come in, or otherwise we'll go to Atle?
Well, just to say that the transmission routes and therefore the key behaviours are going to be different depending on what the nature of the disease is. And we don't know what the next pandemic round the corner is going to be. Even within COVID, to begin with, the emphasis was on surfaces, hands clean, etc. And only over time did it become obvious that it's droplets and aerosol that are really the very key transmission route. So every disease will bring different transmission routes and therefore different behaviours. And as Paul said, it's never going to be one key behaviour. There's going to be a cluster of behaviours that will be focused on.
Thank you. Atle, we go to you in a second, and I just want to already warn Miranda and Theo that the two of you are coming up next. So Atle, over to you.
Thank you. Atle Fredheim from Norway, Norwegian Institute of Public Health and the Oslo Metropolitan University. Thanks for arranging this. It's an important question, how to think forward for the collaboration, of course. And I have a strategic thought. I believe that WHO is a key actor if we want to achieve, I think there's a common goal, more BESSI research. And I think that WHO I think it's a good chance that WHO will play an important role in both facilitating more research into BESSIs in the coming years, but also a topic that I'm interested in, and I hope you are, is preparing for research when we're in a acute situation, so that I don't know exactly how, whether that should be protocols that are finished and agreed upon in advance, whatever, but or collaborations that are ready to go, so we can do huge trials, for instance, the first weeks. I don't know. But I think WHO, we can never do that, I don't think. WHO could do it, and we could be an important actor together with WHO and influence WHO on this. I don't know a lot about this, but I have quite strong signals from people who know WHO that there is actual interest in this, and that they have recognized there's a common understanding in WHO that the lack of evidence with regards to these types of interventions is a big problem. And then a small strategic thing that might be sensitive, I have no idea, but I have unfortunately a sense that we've lost the name game. Are we the only ones who are using BESSI? NPIs seems to have sort of won and be so overlapping. And I also saw that WHO has started to use something else, PHSI, Public Health Societal Interventions, which is again an overlapping thing. There's a risk that we're just confusing people, but I have no strong opinion.
Thanks, Atle. I wonder whether we take one other question first before we maybe come back to some of your points on WHO and the name. So Miranda, over to you, please.
Hi, it's Miranda Compston here. I'm based in Melbourne, Australia. I'm at Monash University and the University of Newcastle, Cochrane Public Health. So I'm coming at this from an evidence synthesis background, and just wanted to follow on from something that James mentioned before about priority setting. And while I haven't investigated all the different projects that are going on, I know there's some opportunities coming around the different collaborations that have happened during COVID, where there's been collation of prioritization exercises on a whole range of different topics. And it seems like there's which I'm sure has occurred to you already, a really great opportunity to piggyback on some of those international, like some of them are international level with WHO. There'll be a lot of local ones as well, where we can work out what are the questions that people are asking, and then to what extent have they been answered already. So are there evidence syntheses that have been done? Have those evidence syntheses identified that there's no research and we really need some research, and here's what it might look like that might give us some ideas about what those next steps might be. So I'm sure a lot of the people on this call would have links to some of those other projects as well, but I feel like, there's places we can start that won't necessarily just be one exercise specifically for us, but a lot of great work we can bring together or benefit from other people having done that already.
Yeah, thanks, Miranda. I think we have one last question, so I would propose we take that last question, and then we have a little bit of time to kind of synthesize and round up. Theo, over to you. Yes, there he is.
Hi there. Thank you very much for listening in. It's been an excellent talk, and I just wanted to start by saying I share really that embedding these behaviors across society over the longer term is fundamental. So I'm speaking as the CEO of a public health charity that was founded in the UK. It's global. We had about 60 volunteers, and we have quite a high presence in low to medium income countries. And we've been very focused on trying to build longer term solutions to combat misinformation and also deliver the correct information. Of course, now we're in the paradigm where there's maybe too much information from all areas. So being careful and treading carefully around this subject. We I believe, share a lot of interests in the areas that BESSI cover, and are exploring in more depth the potential of infodemiology and how infodemic management can be better improved. And I think the question is really to yourselves, speaking from a group that's set up largely from Gen Z volunteers to millennials coming from leading universities around the globe in America and the UK, where potential exists to collaborate and with organizations like BESSI. I know a number of our volunteers are at UCL and PhD students as well, and it would be fantastic to work with a well-established organization like yourself in the sense of bringing, when I say well-established, I realize you're recently born, but you all come from very established careers, let's say. Thank you.
Time has no meaning anymore since the pandemic. So yes, firmly established.
Brilliant, thank you.
Great, wonderful, Theo. I think that we have all questions, and a lot of the questions threw up different points, some need for small clarifications. I wonder whether any of my fellow panelists want to come in on any of those before we wrap up.
Can I just say before I forget, based on what Theo was saying, that one of the things we're very interested in is where we don't see ourselves as a top-down executive that's leading this whole thing. I would see us as trying to facilitate exactly the sort of thing you were talking about, Theo. And we need to think of this, not only how can you help the BESSI collaboration, but also how could we help you? And so if you have questions, please, or suggestions, please post them to the GIST mail list. Would be a good way to ask for help. And we would be interested in getting people to help with funding proposals, for example, or local actions. So you please use the collaboration for that widest, for your selfish purposes, if you like, as well as trying to help out with the things that we would like to see done. And for me, that's particularly trying to get funders interested in that, not for us, or not just for us, but for across the globe. We actually have very serious funding problems for everybody involved in trying to do the BESSI type work.
Thank you, Paul. We actually had secret rapporteurs taking notes behind the scenes to allow us to get a brief bird's eye perspective on everything that has been said during the seminar. And Susan will give us some final thoughts in a second, but I wonder whether Ray Thomas can come onto the microphone and tell us a bit of Ray, what have you heard? What are main takeaways from the discussion?
Hi, thanks, Marika. The discussion's been fabulous. I really like the major themes that it seems to have come out. And the biggest one I think that I have written on at the moment is a number of people have mentioned about embedding researchers with the program groups. And I think that was a really interesting idea, and it'd be challenging, obviously, to implement. But because a number of people spoke about that, I thought that was really quite interesting. We have already spoken about, but it was also raised about that idea about a geographical hub for BESSI components and stuff, and what that might look like. And everybody was really quite keen about the long-term approach. So that understanding that this isn't just about COVID, this is a catalyst for a problem that has been identified, but there are longer-term approaches that need to be done. And I haven't quite written up, but when Theo mentioned that need to tread carefully around too much information that's out there, I think that was a really vital point as well, that we need to consider and think about that. So they're my current top themes.
Great, thank you so much, Ray. And with that, I hand over to Susan for some final thoughts and reflections. Susan.
Well, thank you. And thank you all for attending and for your contributions to discussion. And shortly, Marika will put up a closing slide, which will show you how you can keep in touch going forward. So we have a website there, we have an email address that you can contact, and on the website will be the other webinars, if you want to see them, also the JISC mail, how to get in touch with that Paul mentioned. I just wanted to pick up on some of the points that have come out. I think one of the things is we may look established, but we're not. So what we are is a few people with loads of ideas and great intentions and ambition, but that can only be realised if those are shared more widely. So we very much see this as the start of something. We see it as forming networks. So for example, John, you mentioned about the important work that you're involved with, which is so aligned with what we're talking about, and mentioned various other groups. One of the things I think we could usefully do is almost have a global organogram of who we all are and where we are. So we have a network of networks and organizations. I think that could be extremely helpful. And I think you'll have hopefully got the idea of plurality, plurality of disciplines, plurality of types of research methods, plurality of types of context, population, situations that we're in. We haven't talked much about it. We're very aware of the whole issue about inequality, the fact that this pandemic, because of the nature of the inequalities already embedded in societies, have increased those further, and the desire to do something about it. So huge numbers of potential research avenues. And when I say research avenues, I mean research translating into policy and practice. And absolutely, we are wanting to make collaborations of those people who can use and apply research evidence, working alongside those generating research evidence. Somebody raised the name BESSI. Why not call it MPIs? Well, MPIs is defining really important, huge set of interventions in terms of what it's not. It's not pharmacology, but it's not saying what it is. It's a bit like describing doctors as non-dentists. Is not how you go about things if you take things seriously. And again, we had many discussions about what would be the best way of encapsulating the group of types of interventions that are absolutely key to not only preventing epidemics becoming pandemics, but also getting on top of pandemics. And so we felt this was a good overarching set of works. So we're not in competition. It obviously makes things much easier if people are using similar language. We'll just see how things go. We're very relaxed about that. When we started, it was very much in relation to COVID. But as time's gone on, we really want an emphasis on not just how do we reduce transmission that's already happening in a pandemic, but how do we not just, hashtag build back better, but build back fairer, making societies more resilient. So I really hope those of you who've been on the call today will contact us, let us know how you'd like to be involved, give us any ideas about development. We're really open to what sort of groupings we set up, what groups of forum we set up, how we do things. Obviously, we all have rather busy day jobs, and so doing this in our spare time. So really to get this up to the next level, we do need to get funding. We've got a couple of ideas, but bring your ideas with you. And also, as has been said, think about how we can, with the kind of networks that we've been establishing, and I hope we can build on, support and help you in whatever endeavours that you want to do. So great seminar. I hope that you've enjoyed this discussion. Obviously, it would have been so much better if we could have all been together and over several days, but hopefully we can work to that in the future. So I'm looking forward to our paths crossing with many of yours, and also to what this next phase can look like. So please get in touch, let us know your ideas, and we will then be in touch with you with how we can organise this growing collaboration to be most effective and achieve the kind of principles and the aims that we set out at the beginning. So from me, huge thanks, and I feel very excited about going forward with a bigger collaboration.
Thank you, everyone. We'll hope to see you soon. Take care.
Bye.
Thanks, everyone.